Oh, we know cancer can affect just about any part of the body. So how do you know you're getting cancer screenings as often as you should? This morning we're talking about who should get them and when in our house call. We're joined by Christine Brannick. She's the Oncology Outreach Manager at Cone Health Care Center. Christine, thanks so much for joining us.
Thank you.
Let's start with cancer screening specific to women. What should we be checking for?
Well, first of all, there's cervical cancer. Women that are 21 and older should be getting their cervical cancer screenings. The guidelines have changed. It used to be 18, now it's 21. Women that are between 21 and 30 should get a pap smear every 3 years. That's if they're normal. If they are abnormal, then they would obviously need them more frequently. A woman that's older than 30, if she's has no history of an abnormal pap smear, they can also type it for the HPV virus, which is the human papilloma virus, the most common cause of cervical cancer. If both are normal and negative, they can actually go 5 years before their next pap smear. Also, breast cancer is another important cancer women should begin paying attention to their breast to see if they notice any changes in their breast, whether it's the size, the shape of the breast, if they notice any lumps, any discharge. And we think a discharge is spontaneous discharge, not discharge that a woman is expressing. Also to pain. Now, one thing about pain, a lot of times we think, oh, my whole breast hurts. Actually, we're more focused on pain that's what we call focal pain, meaning you can feel it with 2 fingers or less in one specific area of the breast.
What age should a woman start getting a mammogram?
Women should start getting mammograms at age 40. They are every year. And a woman who's had a family history of breast cancer or a history of breast cancer obviously needs to talk to their doctor about the possibility of needing them sooner or at different intervals.
And then for men, a specific kind of screening, just one?
Well, there's the prostate cancer screenings, yes, and those are recommended beginning at age 45. And they recommend a PSA at that age, a baseline, and then after 50, it's typically every year. But again, it's important to talk to your physician about what those recommendations are best for you.
And then screenings that we all need to be getting, making sure we are checking our skin for cancer.
Yes, and that is very important. We want to look for, what we call the ABCDE, meaning the A is the asymmetry, the chain, one side of the mole is not a perfect circle anymore. The B, there's an irregularity in the border. The color, if we see any changes or variations in color, like part of it's brown, part of it's black. The diameter, I always say, if it's bigger than the size of a pencil eraser, definitely needs to be checked. Or E, one that's evolving, one that's kind of changing. We see it's growing over time.
Why is it that sometimes people put off these tests or screenings? We know they can save our lives, and yet oftentimes we go, yeah, I'll do it next year.
Yeah, and it's so important because if we find a cancer earlier, the chance of treatment and cure is so much greater. And we do offer lots of free cancer screenings at Cone Health at our various sites. We actually have got a cervical screening coming up on the 15th. And we have skin cancer screenings coming up in May, early June, and the prostate's in the fall. And there's also, there's the lung cancer screenings. They have found that people that have a high risk of lung cancer, they can get a low dose CT screening. So those that are aged between 55 and 77 that have a history of smoking a pack a day for 30 years or 2 packs a day for 15 years, and that can be very beneficial to them. So again, very important if you're a smoker to talk to your doctor about that.
So again, Cone Health wants to help you out with this with free screenings. You can learn about the different types of cancer screenings that Cone Health offers at conehealth.com/screenings. And for more information on cancer treatments or to find a support group, you can go to conehealth.com/cancer. Christine, thank you so much.
Thank you so much for having me.
House Call on Fox 8 is sponsored by Cone Health.